What is PTSD? Knowing what you're dealing with makes being in a home with PTSD much easier. When my husband Brian got home, we had no idea the extent of long-term damage he was in for. We figured he would heal for a few months and go back to work overseas. Some medical misdiagnosing and a huge lack of understanding on our parts led to this misguided hope. My husband's accident resulted in a traumatic brain injury, organ damage and removal, multiple orthopedic injuries, and PTSD. When he came home from Afghanistan, he was literally stapled together. His behavior seemed odd, but honestly, I just thought he was high on painkillers. He was overly intense and would stare off in space like he wasn't there with us. When it was time to come off the painkillers, I blamed his angry outbursts on drug withdrawal. But the behaviors and emotional distance continued long after the drugs were gone. It seemed like he was sinking into a darkness where no one else could touch him or reach him. My mom, who was taking care of our toddler in the house at the time, started to mention things that concerned her. We had no idea he was suffering with PTSD. The tough thing is that he didn't know either. He has told me many times since his diagnosis that he thought he was going crazy. PTSD can have big components of visual flashbacks, seeing past images, vivid nightmares, and what we call getting stuck in the past situation or situations that led to the PTSD. It's hard, if not impossible, for the person experiencing PTSD to explain what they are going through, particularly when they're experiencing it. It would have been so helpful if we had had guidance in regard to PTSD symptoms right when he got back. As a side note, educate yourself on everything you can to be sure you can advocate for yourself or your family member. We didn't know what we didn't know, and we initially put too much trust in the skills and scruples of others. So, what is PTSD? According to the American Psychiatric Association, post-traumatic stress disorder, PTSD, is a psychiatric disorder that can occur in people who have experienced or witnessed traumatic events such as a natural disaster, a serious accident, a terrorist act, war, combat, rape, or other violent personal assault. They note that PTSD has been known by many names in the past, such as shell shock during the years of World War I and combat fatigue after World War II. However, PTSD does not just happen to combat veterans. PTSD can occur in all people, in people of any ethnicity, nationality, or culture, and at any age. PTSD affects approximately 3.5% of U.S. adults, and an estimated 1 in 11 people will be diagnosed with PTSD in their lifetimes. That's a lot of people! PTSD is relatively common, and yet people with PTSD and their families often live in isolation. We need that to change. The next few slides from the National Institute for Mental Health share common symptoms of PTSD. The list is laid out in a way that helps mental health professionals diagnose patients with PTSD. I would not call this list complete. There are so many facets to PTSD, it would be impossible to make a single list that fits everyone. But this is still very helpful. I will also provide some first-hand experiences that might help you to recognize PTSD when it comes to visit. My husband is always kind of in PTSD, but it ebbs and flows. Sometimes it's sneaking around the edges, and sometimes it's hardcore in your face. These are potential symptoms the survivor may experience. The survivor is the person who directly experienced the trauma or traumas. Do any of these symptoms sound familiar? Re-experiencing symptom, meaning the re-experiencing of the traumatic event or events as if they are happening now. This includes flashbacks, reliving the traumatic event including physical symptoms such as racing heart or sweating. Reoccurring memories or dreams. My husband will wake up screaming. He is often disoriented and it takes him time to realize that he is home and what environment he's in. Remember to be cautious when you are waking a person with PTSD or if you're nearby when they are waking up from a nightmare. There can be physical reactions from the dreams. My husband has not been physically dangerous, but he may flail his arms or act out physically when he's waking up. Distressing thoughts. You might notice the person with PTSD, quote, getting into their head. They are experiencing upsetting thoughts from the trauma or as a result of the trauma. Maybe they are overly protective of themselves or loved ones and are generally afraid because of what they have experienced. You might also notice the person becoming hyper-aware of their surroundings, particularly in public. Physical signs of stress. This can include increased pain, racing heart, sweating, shaking hands, and fast breathing. I can tell when Brian is deep in PTSD by the way his eyes look. Not only can it seem like a different person is looking out at me, but the physical appearance of his eyes actually changes. Avoidance symptoms. For years, our curtains were closed around the clock, and during the early years, my husband would just stay in the bedroom for the majority of the day. The outside world was just too much for him at that time. Avoidance includes staying away from places, events, or objects that are reminders of the experience. Pretty self-explanatory. Avoiding thoughts or feelings related to the traumatic event. The person won't want to be around anything that triggers the fear and ugly feelings. We do not watch war movies in this house, and we do not spend time high in the air. Ferris wheels are a nightmare anyway. Nothing really lost there. Arousal and reactivity symptoms. Being easily startled, feeling tense, on guard, or on edge. Having difficulty concentrating. Having difficulty falling asleep or staying asleep. This is huge in our house. Brian rarely sleeps, and if he does, it's often daytime hours or early evening. We decided a number of years ago that we were better off having separate beds. I can sleep, and he doesn't have to worry about waking me up. Feeling irritable or having angry or aggressive outbursts. Engaging in risky, reckless, or destructive behavior. I have not been sure if this is a lack of control, self-destructive, or both. I'm leaning towards both. Cognition and mood symptoms. Trouble remembering key features of the traumatic event. The other side of this is that things can start to creep forward and kind of leak out of the survivor's memory as time passes. Negative thoughts about oneself or the world. This should probably be a whole topic. Self-esteem is greatly impacted. Just the ability to be normal is hard, but there is so much more to it. Distorted thoughts about the event that cause feelings of blame. Ongoing negative emotions such as fear, anger, guilt, or shame. Loss of interest in previous activities. Nothing is fun when everything is scary. Feelings of social isolation. This is not only huge for the survivor, it is also huge for the family. Difficulty feeling positive emotions such as happiness or satisfaction. To clarify, PTSD is not an anxiety disorder. It has similar elements, but ultimately it functions in a very different way. Anxiety disorders tend to be the result of fearing future events, while PTSD is a result of past events. The other thing is that experiencing a trauma does not necessarily lead to having PTSD. It's difficult to predict who will experience PTSD and who will not. But I'm guessing you're here for a reason, and it's probably PTSD. Some risk factors that increase the chances of developing PTSD are previous childhood trauma, pre-existing emotional or mental health disorders, a person's natural temperament, and a lack of family and/or social support. There are a few types of PTSD that are recognized. In addition to PTSD, which we just discussed above, are CPTSD and secondary PTSD. While PTSD can certainly be the result of a single traumatic event, some people experience what is called complex post-traumatic stress disorder, or CPTSD. According to the U.S. Department of Veterans Affairs, complex PTSD is when a person experiences chronic trauma that continues or repeats for months or years at a time. People who experience chronic trauma often report additional symptoms alongside the formal PTSD symptoms, such as a change in their self-concept and the way they adapt to stressful events. CPTSD is not a separate definition. It is an extension of PTSD that includes the elements of long-term and repeated trauma. Then there is secondary PTSD. According to Psychiatric Times, secondary post-traumatic stress disorder is defined as indirect exposure to trauma through first-hand account or narrative of a traumatic event. Basically, someone is telling you about and sharing their trauma. Those who experience secondary trauma are often family members, caregivers, and professionals working with the person who has experienced the primary traumatic event. The human mind doesn't know the difference between what it sees and experiences firsthand and what it is fed through someone else's accounts of a traumatic event. A mental health worker hearing about rape or a spouse hearing about events in war, to some extent experience those events and are at risk of having their own experiences with post-traumatic stress. After hearing the accounts of these situations, the brain of the person hearing the stories will even create images to complete the mental picture for itself. This is entirely normal and not something that the person hearing about the trauma is trying to do. It's a normal function of the brain, which in this case is not ideal. Recognizing secondary PTSD is important to the family's survival in that family members may be experiencing symptoms of secondary PTSD that are complicating how the family functions. It's also important to note that family members who experience PTSD firsthand may cause trauma in the home, such as physical and emotional abuse, which can result in primary PTSD for family members. Let's go to the next video to learn more about recognizing the symptoms of PTSD.